Welcome to Season 18 of Marrow Masters, produced for the National Bone Marrow Transplant Link and sponsored by Sanofi and Jazz Pharmaceuticals. This season is all about the caregivers. Our guests will offer up their best tips, experiences, and advice. We'll cover the importance of self-care and share heartwarming stories of compassion and love. Now, here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. So today we have with us Lorri Pimentel of Santa Rosa, California. Lorri is a survivor who will share her story with you, and it is a story of resilience and grace. Lorri's been through a lot, and she's going to share with us today her caregiving experience, including tips that she and her caregivers learned along the way. Listeners will take away a great deal of advice today. Let's get started. Welcome, Lorri.
Thank you, Peggy. It's good to be here.
Let's talk about first your diagnosis and your story leading up to the need for a bone marrow transplant.
Well, a little background. I'm a 65-year-old retired occupational therapist. I'm a divorced mom of 3. I have a 25-year-old daughter and twins that are 21, all of them in universities right now. My first experience with cancer was when I had DCIS, or breast cancer that's in situ, which means it's in the duct. That was in 2016.
Okay.
And I had 2 lumpectomies and 5 weeks of daily radiation after that. My surprise was when I had cancer again. I developed AML in 2019, 3 years to the day later, and they believe it was linked to the radiation I received from my breast cancer. The first treatment was a 7-3 chemotherapy regimen that was in and out of the hospital at least 7 times. I had fungal pneumonia during that time and E. coli infections because of my compromised immune system. 7 months later, about the time when the COVID pandemic became locked down, I was free of cancer. But 9 months later, I relapsed and I had to have intense chemotherapy at UC San Francisco and a stem cell transplant on March 30th of 2021.
Wow, you've been through a lot. You did not have an easy road. Share with us how you and your loved ones made caregiving work for you with your situation.
Well, I actually had multiple caregivers, each who stayed with me for about a week for the first 3 months post bone marrow transplant. During my diagnosis of AML, I was in the midst of a 2-year divorce, and so my ex was not a consideration for caregiving once I had the transplant. My eldest daughter was away at college, and my twins were still in high school, which was during the pandemic. They stayed with their dad during multiple hospitalizations on my part. So my friends were my angels, and my work colleagues. They all came through for me.
Wow, Lorri, this just shows that there's not a one-size-fits-all when it comes to this. And I think it's so important that we're covering this, that not everyone has an easy road with finding a caregiver. And I'm just like, I want to meet your friends because I think to have people that can step up like that for you is just very special. The rotation is interesting to me too. It probably made it nice that you didn't have the same caregiver all the time and that there was always something new to talk about.
That's true.
One way to look at it, right?
Absolutely. Nobody got worn out.
Yeah, no, it's an interesting thought. So what are some of the best tips that you and your gang realized along the way?
The first one is that sometimes you have a change of schedule during the bone marrow transplant itself. You may leave the hospital early, as I did. So I wasn't prepared for 3 or 4 days of someone coming in right away because I expected the schedule all laid out ahead of time would be followed.
Okay.
So I would say have a person ready to change their schedule if need be. That came as a surprise.
Sure.
I also found out day 1 that I came home from the hospital, I had a reaction to medication. I had too much magnesium in my IV and I overdosed. So I had sudden nausea, vomiting, shortness of breath, and my medical oncologist told me to call 911 and I was hospitalized. So that was a real shock.
I bet.
I would say have names and numbers of the bone marrow transplant oncologist and team with you when you go to the hospital have those numbers available for your caregiver at home. Be sure that the patient has a Ziploc bag of all your medications when you go to the hospital.
Oh, that's a good one.
Another one I would say is that if you can ask for a home health nurse to be ordered before you leave the hospital, that might be of great help. So she can administer an IV medication if needed through an IV pump. If you are the first or only caregiver, the discharge team will go over all of this with you before you leave the hospital. It's about a 5-hour training session about all the do's and don'ts.
Huh. Okay.
Another one would be to keep a written report of all the information that you need to record so that when you go to the outpatient visits, which are pretty frequent after transplant, you know what's going on and you have recorded it. I would suggest you that if it's okay with the patient, as a caregiver, that you stay with the patient to tell the medical team of your observations and answer any questions that she may have missed. I would also note any medication changes and adjust those medications when you get back home with a pill box so you know exactly what changes there are. So many times there are so many medications that it can get confusing unless you have two people looking at it.
Absolutely.
And lastly, I would say to have a plan B, a backup person in case you can't be there overnight as a caregiver. You are not the one to be there if you are sick, ever. Your patient is too vulnerable. When in doubt, wear an N95 mask and try to find someone else to cover for you.
Great advice, Lorri. So you shared with me some things that you learned by mistake. So I understand you have some real nuggets to share, so let's hear it.
I sure do. There's some things I've learned by mistake that I would really advise you as a patient and as a caregiver never to do. One of them, it has to do with the GvHD. About 3 months post-transplant, when the tacrolimus is being titrated or lessened so that the new immune system can take over, you may develop an intensely itchy rash all over your body. So at this point, I would suggest you let the doctor know right away and do not expose yourself to the sun. I did that and ended up in the hospital with major burns on my hands and feet, both sides, and on my face. They were very uncomfortable, and it took me a long time to recover from. It can be very, very debilitating.
Was that GvHD, the rash, Lorri?
Yes, that's one kind of GvHD you can get. It's mostly the one that is the most prevalent.
Yes. Okay.
Another part of GvHD might be mucositis, where you have lots of sores in your mouth from all of the chemotherapy. And for that, I would suggest that you use a water pick to help clean your teeth and gently rinse out your mouth. Sometimes you can't even get your mouth open to swallow and chew. I would continue with soda, salt, water rinses several times a day and try to drink things with a straw so you can get the adequate nutrition when you can't really open your mouth and try to chew the food you have. I also would recommend what the doctors have prescribed to me, which is a magic mouthwash. What it does is it numbs the inside of your mouth. So you gargle with it and then you spit it out. And that way you can maybe chew and swallow something without so much discomfort.
I didn't know about that. Huh.
And the other piece that I didn't know is that later on, as you improve, they will allow you to brush your teeth more. And I would request from your dentist a prescription fluoride toothpaste, as the chemo and the steroids tend to rapidly accelerate tooth decay. Ask your dentist for treatment options for dry mouth as well.
Very good. Thank you.
Oh, one more thing.
Sure.
One or two more things.
Yes.
Ask your oncologist for relief from steroid-induced insomnia. I was on prednisone for quite a long time with my GvHD of the skin, and it was very difficult for me to sleep. So I was running 24/7, and I was driving my friends crazy. And someone wanted me to take a gummy, and it had THC in it. And that was one of my mistakes of taking that. It was a fun experience. I'd never done that before. However, my doctor said, please let me order medical marijuana prescriptions called Marrow instead so that I know exactly what you're getting with all your other meds. I also know that it's important to stop driving if you have steroid-induced cataracts. I had 2 cataracts and I was really, really having a tough time getting around. So getting them removed as soon as possible is a really good idea. And also going to the GvHD eye and skin specialist on an annual basis after your transplant is a really good idea. My ophthalmologist provided special drops and ductal plugs for my dry eyes. He recommended having my blood drawn, spun down, and then having the resulting serum returned to me from the lab for use with my severe eye disease, with my severe eye dryness. It's better than anything I've tried over the counter, and it's not yet FDA approved, so insurance currently will not cover it.
Okay.
There's a cost of about $350 every 6 months, and it's a good investment, really effective for dry eye relief.
Thank you for that. So, Lorri, let's talk about prescriptions. What was your experience with that?
Well, I would suggest that refilling prescriptions is important to do as soon as you leave the outpatient appointments. There are many, many changes in your prescription, some lowering them, some eliminating, sometimes having some other ones added. So it's real important to keep track of the consistency in the med intake for the caregiver, to watch it carefully to make sure a patient's taking them. You will take about 20 different medications at a time over the course of one day.
Wow.
And if we fail to take a medication, using a pill box will kind of let us know that we've done that. The other piece is that sometimes you'll forget to take your antidepressant. And if it's too late in the day, you're not going to sleep at night if you take an antidepressant. So it's better to wait and take it the next day. But some of your other medications, it's really pertinent that you take them consistently on time. And if you haven't done, let the doctor know.
Well, thank you, Lorri. Great advice. So let's talk about transportation right after a transplant, getting around. You told me something in an email that I just thought was so important. If you could share that with everyone.
Of course. I live about 60 miles north of San Francisco. So with all the commute traffic back and forth in the Bay Area, I really had to plan my visits accordingly so I wouldn't be stuck in traffic and have a double time on my commute. So for the first 3 months, I was asking someone to drive me all the time. It didn't have to be the people that was the caregiver necessarily. Some people prefer to just help out in a different way rather than staying 24/7 with me. I would ask the driver to take me. If I ever, as a patient, were to say, I think I can drive myself, ask the doctor. Sometimes we're not able to make clear decisions about our ability to drive, and maybe we'll be very tired at the end of the commute. It's really, really better to let someone else drive, especially when some of the medications may cause us to be drowsy.
So true. All right, Lorri, let's talk about when you got home, early survivorship. Give us some more information.
So life when I got home was a bit different in many ways. I would suggest the most important things that I learned that I mentor other people about is to watch for skin exposure. Even as a passenger on the side of the vehicle where the sun is on, you need to be protected with sunscreen and UV protected clothing to cover that arm or that side of the neck. I would say as a caregiver, do not encourage your patient to ever go outside between the times of 10 a.m. to 4 p.m. when the sun rays are at their highest, especially in the summer when there's longer time with rays. You just don't need the headache of having a skin rash, nor the possibility of cancer later on. I would also say as a caregiver to give your patient their needed space to connect with other friends and family members privately and remotely. We are not really in a stupor that we can't provide for ourselves. It's just that we're medically fragile with a new maturing immune system and lots of unanticipated potholes along our journey. Times when we get a virus, times when we get a cold, times when we need to be rehospitalized. One of the biggest struggles that I had found was social isolation, especially in light of this was going on during COVID. I would really recommend people find other avenues of distraction and fun, things that they can do inside the house. Like for me, it was art, watercolor pencil art, and yoga classes online, or blood cancer online chat groups where you meet with other people with similar diagnoses and share your stories and other suggestions. I found it was really helpful to FaceTime and to Zoom with other family members. In fact, our whole family got together and Zoomed once a month just to check in with each other. And that was really something I looked forward to.
Oh, yeah.
I would also lastly say to always follow the cooking recommendations explicitly, especially with food handling, saving and reheating leftovers. Make sure you throw away food that is more than a day old to avoid bacterial contamination. That's especially true with rice. You never, ever have rice the next day because it's one of the number one ways that you can get E. coli bacteria.
Oh, wow.
I would also say to change your dish rags and your kitchen towels daily to make sure that the appliances in your kitchen, bathroom are cleaned with disinfectant wipes, and place water near your patient as a caregiver so that they are constantly being reminded to drink about 2 to 3 liters of water a day. I would suggest even changing refrigerator filters because they're not going to remember that with all their chemo talk.
Sure. That's a good one. So, Lorri, you made me think of something that I got to be honest, I don't think about all the time. Extreme weather conditions and considerations. Can you share more about that?
Oh, yes. We here in Northern California are used to summer and fall fires. And so we have a lot of smoke from wildfires from far away. So I would suggest to keep windows closed and using the AC, using an air purifier in the room that the patient is mostly located, especially at night. They need to have clean air.
Mm-hmm.
Make sure that the AC and the heater and air purifier systems have clean filters. Have an evacuation plan in case of an unanticipated emergencies. And we've certainly seen this throughout our country with wildfires, floods, earthquakes, hurricanes, and tornadoes. You need to know where you're going to go with what essentials you have to have, such as your medication and certainly your phone charger. Make arrangements for your pets and sleeping accommodations ahead of time. And I would say certainly to make sure that you have that phone available since you may not have access to power or phone communication.
Isn't that the truth? Good advice, Lorri. Thank you. So, Lorri, what is life like today? I am so inspired by you. You've been on some of our programs and you're just always moving, and I just want to hear what you're up to.
Well, it's been 4.5 years since my bone marrow transplant, and I am just thrilled to be alive. I am not the same person I was before in that I can't do as much. I used to be an avid runner, and now I walk. And I walk with my dog at least 2 miles a day in the cool of the day when it's not too hot in the sun. I'm an artist, and I do a lot of watercolor art, and I practice yoga each day. I'm a pianist, so I substitute for various musicians at church every once in a while they're on vacation. And I'm out and about with exercise. I'm a nature lover, and so I've made a point of becoming trained to be a docent for various school groups at the Armstrong Redwood State Park and the Sonoma Coast State Park Tide Pool program. I'm also a First Connection volunteer with Leukemia Lymphoma Society, and I attend weekly LLS acute leukemia chat groups. I'm also a peer connection volunteer for the former Be the Match, now called NMDP, to help mentor new patients through their treatments. And I've actually written my own book about my own cancer experience that I hope to publish sometime soon.
So, Lorri, is there anything else that you want to cover today? Anything we might have missed? Although I think we covered a lot.
Yes. My final advice would be that the BMT treatment has evolved over time, and usually provides you with a new hope for any person with AML. It's a slow recovery, but it's worth it. But every day I wake up and I'm thankful that I get another day. And right now I just want to make a difference for others who follow my same path.
Well, and I'd say you are, just even being on this podcast today, taking the time to share your experience and your heart and your best tips. And we really appreciate it, Lorri. Thank you so much.
You're very welcome.
This has been the Marrow Masters podcast. Please share this episode with someone you think would benefit from it. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple, Spotify, YouTube, or wherever you're listening right now. Marrow Masters is produced for the National Bone Marrow Transplant Link. Established in 1992, the NBMT Link strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow transplant from diagnosis through survivorship. The Marrow Masters podcast is produced by JAG Podcast Productions online at jagpodcastproductions.com.